Okay, good morning again, everybody, and thank you for taking the time to join. My name is Michele Grand. I'm a licensed massage therapist at Smilo Cancer Hospital, and I'm so pleased and honored to have this time with you today to talk a little bit about self-massage. Self-massage we can do for ourselves at any time. We use our fingers and we use different kinds of pressure. And I'm going to talk a little bit about the soft tissue that we're going to reach when we press onto our skin. To begin, a few of the benefits of self-massage. It will increase our circulation, especially to the nerve endings. It calms the nerves and lubricates the joints. It can increase our mental alertness. It can improve elimination of impurities from the body. It can aid in smoother and softer skin, increased levels of stamina throughout the day, and better sleep through the evening, through the night. What we have under our skin are basic, there's more than these things, but we're gonna just talk about these three things. We have trigger points, we have connective tissue, and we have fascia. And those are the three things that we're gonna activate when we do our self-massage today. Trigger points are muscle knots. They're often sensitive spots in our soft tissue. And what it is, it's a small patch of tightly contracted muscle. And that's as opposed to a whole muscle spasm like a Charlie horse. Generally, if the muscle fibers are in a relaxed state, they're flat. But when they become contracted in these little mini spots, they feel like little balls of tight muscle. And they choke off our blood supply, and then that irritates them even more. In addition to the trigger points, we have connective tissue. Connective tissue is fibrous in its density, and connective tissue includes bone, ligaments, tendons, cartilage, and fat tissue. Thirdly, we have fascia. And fascia is a band or sheet of connective tissue. It's primarily made of collagen. It's beneath the skin also, and it attaches, stabilizes, encloses, and separates muscles and other internal organs. So again, as we go through our self-massage from head down to our toes, when we touch the skin and we're pressing in, these are the soft tissue that we're going to try to activate and increase our blood flow to. The motions we're going to use when we do self-massage are going to be circular motions, kneading motions, which is also called petrissage, long and broad strokes, which is called effleurage, and where needed, some deeper pressure. We'll do a little friction maybe around the joints. And what we're trying to do again is we're going to detox our body. We're going to increase our blood flow and circulation, and we're going to basically just nurture ourselves. We're going to fill ourselves with love and kindness. And the third thing I just want to mention is something called, you may have heard of myofascial pain. Myo means muscle, and fascia, we know, is the band of connective tissue around the muscle. And the myofascial pain is what we feel when we have these muscle knots, pain, and trigger points. So what we want to remember too when we're done, of course, is to wash our hands, because we're gonna, we could sometimes start with our feet and work up, but we're gonna start with our head and work down, then wash our hands, of course, when we're finished. So to begin, we're gonna start with our head and our face. The first thing I'd like you to do as we begin the self-massage is place one index finger on the top of either side of the center line of your head. If you prefer to use a couple of fingers, that's fine. You could even use 1, 2, or 3 fingers. So what we're going to do on both sides of the center line is we're going to press in. As we massage, you're going to feel releases, so you're going to want to keep breathing, continue your breath as we go. And in little circular motions, we're going to press forward from the back of our head to the forward of our head. Make little circles, and you'll feel your scalp move a little bit as we go. And continue the breath, very important to release. Now we're going to take one finger and we're going to go directly down the center line as we continue to breathe. Excellent. Now we're going to move about an inch away from the center line, and you could take all your fingers, make like a little claw grip with your thumbs. And we're going to start at the back and just continue forward. Just give a good release. Press in with pressure to your comfort level. You don't want to be in terrible pain, but you should feel some sensitivity for sure as you hit those little trigger points. When you get to the top of the ear here, you're going to feel probably a little more soreness and sensitivity, which is fine and good. Come forward towards your temples. The thumb here will give you nice pressure. Make little circles at your temple with your thumbs. Feel the release, feel your shoulders drop a bit. Good, excellent. Now we're going to come with the index finger to the top of your forehead, and we're going to press outward. And we're going to move slowly down the forehead towards the eyebrows. And continue your breath. Move downwards. Drop your shoulders and feel the release. Excellent. Now when we get to the center, you can take your thumb or any finger right between the eyebrows and just make little circles. Feel the release. Excellent. Good. Go ahead below the eyebrow. This is where we get that sinus pressure pain. So we can go a little softer, a little more gentle. Just make little circles with your thumb. Stretch it out a little bit. Back to the temples. We're going to work our way down. We're going to go right here below the eye socket, right here at the top of the cheekbone. Go ahead and make little circles and move your way around, again, back up towards the temple. Good. Now we're going to go below the cheekbone at the base of the nose. Feel a little sensitivity there. Always when we get to the jaw, we get that tight jaw. Many of us clench our jaw at night. Now we're going to make little circles here at the base of the jaw. You could open your mouth a little bit and get more of a release. Good. You could press back from the chin backwards. Give a good stretch. Stretching the fascia. Good. Go upward a little bit. Good. And now again, right at the jaw, where the jaw meets the ear, you could take an index finger, be tender there. You can go back behind the ear a little bit, right at the base of the jaw. Make little circles there for release and continue your breath. Good. Good. Now we're going to work our way back down towards our neck. We'll take one hand and put your hand behind your head on your neck and just give a little squeeze. Give a little squeeze, a little neck rub there. Good. You can move up a little bit towards your hairline. You could switch hands with your other hand. Give a little squeeze of your neck. Start from the bottom of your neck and work your way up a little bit. Now exhale and let your head drop, stretching the back of your neck slowly. And you could use one hand to sort of guide your head downward so your chin touches your chest, and give a little stretch. Inhale and lift your head. And exhale again as you stretch your neck down. Only stretch to a comfortable point for you. Inhale up. You can stretch now to one side, downward to the right. And up, switch hands, and downward to the left a little. And feel that stretch in your shoulders and neck. Excellent. Now we're going to take our fingertips and we're just going to go to the back of the head, the base of the scalp at the occipital ridge here, starting at the middle. You'll feel the very top of your cervical vertebra, and we're going to start at the middle and just release little circles outwards, moving towards your ear at the base of the head and the top of the neck. Just move along the base of the hairline, pressing and releasing from the center of your head out towards your ears. You'll feel little sensitive spots probably as you get towards your ears, and that's good. You can loosen the pressure a little bit when you get there. Good, good. You could take the base of your chin here underneath, and you could stretch that out. It's good for circulation. We hope it increases the flexibility of our skin so we're not so saggy. It certainly can't hurt to try. And just give little releases there. Gentle. If you feel sensitive, just loosen up on the pressure a little bit. Good. Excellent. Very good. Just take a moment. Breathe. If you want to grab a glass of water, because we're doing a lot of release here. Sometimes you get a little dehydrated, a little thirsty, so feel free to take a drink of water. We're going to move now to our shoulders. So what we're going to do is we're going to take our right hand and go over to our left shoulder, and we're just going to make nice squeezes, little squeezes. Take that muscle, that's the trapezius, that's a strong muscle, so you can use extra pressure. And you could pull forward for release. Could feel the warmth, you could feel the blood flow starting here. We'll make little circles. Just move around and around. And when you're ready, we can move to the other side. Again, pull forward. Use some good pressure here. Make circles, circles. And kneading, that petrissage, that kneading motion will aid in increasing blood flow. Excellent. Very good. Now what we're going to do is we're going to work our way from the shoulders down towards our wrist. Just make little squeezing, kneading motions. You can go up and down several times and get in there. Use some pressure. Like a twisting motion for release. You'll know it feels good as you do it. You'll know what's right for you. You'll know pressure-wise and motion-wise what feels good on that muscle. Good. When we get to the hand, just give it a nice little squeeze on the hand. Nice. Squeeze the fingers together a little bit. We use our hands so much, and there's muscles here, there's soft tissue here that gets tight. We could take each finger and give a little squeeze and a little pull at the same time. Nice release there for the fingers. Okay, good. Breath in. We're going to move to the other side. We're going to go down from the shoulder all the way down to the wrist. Kind of again, a squeezing motion here. Up and down. Use pressure that's comfortable for you. Not too light, but you don't want to feel too much pain. Twisting motion. Up and down. You could feel the warmth. Your skin may be getting a little red. It's exactly what we want. When we get to the hand again, just a nice squeezing motion around the fingers. And when we get to each finger, we can give a little squeeze and a slight little pull forward, not too much to cause any sort of pain or discomfort. Excellent. Go back up one more time. And down. You can even give your arms a slight little pull, a slight little stretch. Excellent. Very good. We could do a little bit of work here at the clavicle, at the collarbone. The trapezius comes across the top of the shoulders and connects over here. So sometimes we could feel a little aggravation here. Doing little gentle circle motions here can also just help open up the breath a little bit. As we work, we always keep in mind the chakras too. We started with the crown, we went to the third eye, and here is our throat chakra. So as we massage the soft tissue, we're also opening up the energy channels as well. And then moving down to the heart area, the heart center. Very gentle, little circles. The pec muscles are here. We give those a little stretch and release as well. Excellent. Now working in the back again, we just do on ourselves when we do self-massage, we just do the best that we can with our hands. We can, of course, use a foam roller and roll on that, which is an excellent release. You can use a tennis ball down at the base of your lumbar spine for release there, in the buttocks as well. But for self-massage, we're just going to reach back and do the best we can to reach whatever it is that you can reach. Okay? So we're going to start down here at the lumbar spine, not on the bone, but to the left and the right of the vertebra. You'll feel like a softness there. And we're just going to take our thumbs as best as we can and just make little circles going on up from the lumbar. That's tight muscles there, so you can kind of get in as best as you can. Then we hit the thoracic vertebra and those muscles as best we can. Make little circles as best we can. And then for the cervical, just reach from the top down, over your shoulders and down the back as best you can. You can start at the top of the neck and just work your way down around the cervical vertebra in the soft tissue area, not directly on the bone, but in the soft tissue. Good. On your own, as you continue self-massage, you just do the best you can with that. And it's something you can do just when you feel stressed and tight and when you just need some muscular release. You could focus on the parts of your body that need more, or you could do what we're doing today, kind of an all-over massage. Now we're going to move down to the legs and the feet a little bit. So moving to the best I can, you can take your right leg and put it over your knee if you like, or just whatever is comfortable for you. But for the purpose of my showing you what we're going to do, I'm just going to bring the camera down a little bit, and there we go. So what we're going to do is just the thigh muscles. We're just going to make, again, that petrissage, that kneading motion around the thighs, starting at the top of the hip bone here, and just kneading downwards. I'm going to bring this forward too to get a little better view. When you get to the knees, around any joint, we can do a little friction, which is taking the tips of your fingers around the bone. You'll feel the bony area, and just make little circles. Follow the bone around at the joint. And this is what helps lubricate the joint, and it could help to alleviate some pain that you may have there. And you can feel little tender spots here and there, and that can help to just release those spots. Sometimes we get like tight shins. Along the front here, I'm going to lift up my pants to show you. Along the front here, just you'll feel there's a lot of muscle, soft tissue here that gets very tight and tender. Just press in and around, again, to your comfort level. And just move your way down towards your ankle. You do that several times, moving outward a little bit. And just rub in and around, down to the ankle. You could take your ankle and just make gentle circles around, and in the opposite direction around. Then give it a little shake too. Give it a little shake. Now at the bottom of your foot, this is the plantar area. Some people get plantar fasciitis. It's when the connective tissue gets all gummed up and it just needs to move. So the motion we want to use is from the heel to up towards the toe. And it's a long, broad stroke, but it's a deep stroke. It's particularly at the arch. You could feel some sensitivity there. But you want to press in and up. Just press in and up. And just take your time and just work your way. Just work your way around the bottom of the foot. When you get up here towards the toes, you can make little circles on the bottom for release, and move your way up towards the toe. And you can give a little, again, like we did on the fingers, a little squeeze and a pull on each toe. Gentle, not to cause too much pain. You might even feel a little popping and a little cracking there, which is good. And then again on the front here, there's tendons. We want to start from the toe and work upwards. But sometimes those tendons get aggravated. Maybe we wear the wrong shoes, or too much walking and exercise. Sometimes we just want to release that from the toe, especially that big toe, upwards. And you can even go all the way up to the knee. You can go from the toe up to the knee, each one, because those tendons connect the muscles to the bone. The ligaments connect the bone to the bone. Give a nice release. Excellent. And we always want to do both sides. So we'll start up again here at the hip. Just little circles here, release the hip. All the way around. And just work your way down. Little squeezes. The quads. We'll get to our knee. Can make little circles around the knee, again, around the joint. Any joint we can do the friction. Little circles like this around. That's a good release. Could do that around our elbows, around our shoulders, around our wrists. And then again, we're going to work our way down. Just give it a good pull there. A good pull and a good rub. These muscles are firm and they're strong, so we don't have to be too tender and too gentle. We want to use some friction. And then just work your way down towards the ankle. If you want to use the palm of your hand, we can do that as well. And work your way down in broader strokes. Press in and down. Let's continue the breath down the front, shin, good. To the ankle, and again, can make little circles around. Slow circles in the other way. Excellent. And then again, the bottom of the foot, particularly at the arch, you want to start at the heel and move up towards the toes. Excellent. Just keep that going. You can use a moderate amount of pressure all the way up to the toes. Don't stop short because we want to activate the entire muscle. Sometimes we feel trigger point pain, but it's not the location of the trigger point itself. Sometimes there's referred pain, which is why it's always important to try to work the entire muscle and not just that one little spot. Up towards the toes. Again, when you get to the top of the foot here by the toes, press in, give good pressure here below the toes. Gets very tight there sometimes. And then again, squeeze and pull on the toes for a nice release. And once again, let's get those tendons going here from the toe upward, from the toe towards the ankle. Every toe has its own tendon. That's what you see here. Give that a good press, pull, and stretch. And then you can continue, you could do that again all the way up to the knee. Start at the toe and go all the way up. And do that all the way across the top of the foot. And continue the breath because that's a nice release. Again. And the pinky side. Good. Excellent. All right, we'll just take a moment. We've gone again, we'll wash our hands when we're done, but we've gone today, we started at the top of the head and we've moved our way down to the neck, the shoulders, the arms, the back, along the spine, the hips, the legs, and the feet. And this is something, again, you can do in your own time, in your own way, doing the whole body or just focusing on the areas that you may need that particular day. So that's it in a nutshell. I hope it was helpful. I hope it made sense to you. And just, you know, enjoy your day. Drink water, hydrate, and just take care of yourselves. Okay, it was good to be with you, and I hope to see you again soon. All right, take care, everybody.